For a long time, we were labeled as mid-levels. You're not a physician, you're no longer a nurse, you're not a tech. So what are you? You're this in between. But we've moved past that. We recognize the great value that this section of healthcare providers is bringing. Hence, we have advanced practice providers. An APP, or an advanced practice provider, is somebody who has gone on to receive additional education past being a nurse or being a corpsman. Nurse practitioners are nurses first. They get a bachelor's of science as a nurse, and then they go on to get a master's degree. Many of them now are pursuing doctoral degrees and are becoming DNPs. Then you have the physician associate side of the coin. Those folks go to PA school. It started out as corpsmen who were part of the military, who got unbelievable training on the battlefield and then came back, and we wanted to use them more appropriately. And that's really how the physician associates was born. Together, we became this profession, which is advanced practice providers. I think there's a bigger need for advanced practice providers primarily because our population is aging. People are living much, much longer with significantly more chronic disease than we've ever seen. There's a tremendous amount of folks that live in rural areas that have zero access to anybody. They can live within probably 75 to 100 miles of no one who can see them when they're sick, meaning that they're entering our systems at the emergency room. Clinics, hospitals are recognizing our patients are sicker. The way that we have to care for them is through a team methodology. That's no longer just the doctor and the nurse. It's now the doctor, this additional layer, which is advanced practice providers, and then nurses and techs and all those other amazing people that make hospitals and clinics function. You pair physicians and APPs together, you get a winning combination, which it benefits the system and it benefits the patient. I think we will see more nurse practitioners and physician associates entering subspecialty care. They have a very large presence in primary care, but I think we're going to continue to see them moving into oncology, behavioral health, cardiothoracic surgeries. They've been recognized as being able to provide excellent care, but also because those teams are determining that having an additional layer of our type of provider is essential for making sure that patients get the outcomes that they need to achieve.